In tonight's Health Alert, a new treatment at Innova Fair Oaks Hospital for those of you suffering from knee pain that's not going away. Doctors say the procedure can have you back on your feet in a third less time than full joint replacement while saving some healthy bone.
Long walks through the airports and standing, and it was very bad.
Years as an international flight attendant left Danilo Vargas with severe arthritis in his knee. The pain got so bad it was hindering the 62-year-old's everyday life and his livelihood.
I'm very active, and to me, I was getting depressed. It was affecting me because I couldn't do the things I like to do. I like to walk. I like to dance.
He had physical therapy, cortisone shots, and other treatments, but it didn't alleviate the pain. The next step was surgery, and Danilo's doctor recommended a new, less invasive option called Makoplasty. It's a partial knee resurfacing, replacing the need for patients to have a total joint replacement when only part of the cartilage is worn away. Dr. Tony Aram can do that with the help of a surgical robot nicknamed Rio.
During surgery, the surgeon actually registers the patient's abnormal anatomy into the computer. And once those things match up and validated, the robot can execute that operation. The precision of the robot is phenomenal.
Dr. Aram says the incision is smaller and can be performed on an outpatient basis. He smooths out any damaged bone and puts in an implant to allow the knee joint to move smoothly again.
Number one, okay, they get to preserve a large percentage of their normal knee, their ligaments. The second thing is, because you are doing this operation so perfectly each time, the patient has a more natural feel. And some of the side benefit of this is that it's less pain because the operation is less invasive. The patient returned to activity much quicker.
Danilo can't believe how quickly he's back on his feet and now in the air doing what he loves.
It has improved my life, 100%.
Okay, people who suffer from severe osteoarthritis and have damage in all three compartments of the knee joint, they are not a good candidate for this Makoplasty, but the procedure is covered by most insurance companies.
All right, but let me ask you this. Is this one of those things where you get it done and then 6 months, a year, 2 years later, you need the knee replacement anyhow?
Certainly that's not the hope. Obviously, they hope that this takes, that the operation works and still keeps the healthy bone. It is possible that a person might have to go on to full knee replacement again, but they hope that doesn't happen. Dr. Aram says you wouldn't have really lost much by trying this Makoplasty because patients preserve ligaments, healthy bone, much less invasive, and it's a lot better way to heal.
So in other words, it's worth a shot.
That's his take, again, for many people, and obviously with our flight attendant, he's back going at what he likes to do.
All right, thanks, Anita. I appreciate that.
Tomorrow morning, Dr. Aram joins us live in the studio at 6:15 to explain why Makoplasty is so special compared to other knee surgeries, and he gives everybody tips on keeping our joints healthy and hopefully avoiding surgery altogether.